Hello everyone, thanks for taking interest in my evidence-based practice project poster. My name is Corey Bieniak. This is for Nursing 348 at the University at Buffalo. My project poster is related to decreasing UTI regarding long-term urinary Foley replacement. The purpose and practice problem that I found on my unit at my facility was about a high rate of UTI occurrence over the last 6 months among patients with long-term Foley use, which is about 28 to 30 days or more. A UTI is associated with increases in morbidity and mortality, as well as an increased cost in hospitalization. So the purpose of this whole project is to decrease UTI rates in patients with long-term indwelling Foley catheter use by utilizing the best evidence available to change current nursing practice in the adult mechanical ventilation unit at High Point on Michigan. The clinical research question in PICO format that has been created is P for population. For adult ventilator patients whom require long-term use of an indwelling urinary Foley catheter, I intervention, would leaving the Foley in place and only changing on an as-needed basis, C, compared to scheduled Foley monthly changes or replacement, O, outcome, reduce UTI rate of X over the last 6 months to 0 after 6 months. Let's take a look at the evidence-based practice research process. The database's search included filtered and unfiltered sources through CINAHL, Cochrane, PubMed, and the Nursing Reference Center. Keywords and phrases utilized were urinary catheter management, catheter replacement, UTI, long-term, and CAUTI prevention. Inclusion criteria were articles between 2011 and 2016 that were English research articles that contained long-term Foley use 28 to 30 days or more. And exclusion criteria included level of evidence greater than 3 and articles of short-term Foley use less than 28 to 30 days. Take a look here at the Table 1 search history. You can see only 2 articles made it through the research elimination process. Our second table, you can see over here, table of evidence. During the data extraction, what I found was a review utilizing a randomized controlled trial amongst elderly men, showing a decrease in UTI rate for monthly replacement. The findings, however, were not of significance. The other review involving a clinical guideline that involved 5 randomized controlled trials showed a higher rate of infection associated with frequent Foley changes, and a suggestion to follow Foley manufacturer suggestion of changing about every 12 weeks. There is a need for more data-specific studies that remains. The practice recommendation from the analysis of evidence that is being recommended. First, indwelling urinary catheters for long-term use should not be changed at monthly fixed intervals, except only when tubing is noted to be discolored, malodorous, or non-functional. A part of this recommendation is that indwelling urinary catheters for long-term use shall be changed as per catheter manufacturer suggestion, usually every 12 weeks, with the same exceptions as previously stated. The second separate recommendation is to conduct an in-house study to determine which intervention is most effective and contribute data to the problem-specific topic. Now, as far as institutional review board involvement, it is not necessary to have IRB involvement if just implementing the researched evidence-based practice clinical guideline. It is necessary to gain IRB approval prior to conducting an in-house study that may pose risk to patients. Components and areas of concern appraised by the IRB to cover would be risk-benefit analysis, informed consent, selection of subjects, privacy and confidentiality, monitoring and observation, additional safeguards, incentives for participation, and continuing review. Now, how we're going to implement this new protocol is we're going to meet with the clinical educator to collaborate and have a new protocol typed up. We're going to ensure the clinical guideline or policy is made accessible to all staff, and we're going to schedule in-service sessions for every shift until every LPN and RN are notified of the change. We're going to have sheets for them to sign to hold accountability that they were informed of the changes. To gain interest and compliance in this change, we're going to advise all nurses of our outcome goals and rationale to follow current recommended practice. We're going to communicate by email, flyer, poster presentation. Work computer screensavers are helpful as well. And we're going to provide unit managers a budget to reward staff compliance. Practice change evaluation. We have an outcome measurement plan. Keep a log in a yellow binder at the nurse's station to track patients with long-term Foley use. This is to be the responsibility of the charge nurse each shift. We're going to include reasons for change and occurrence of UTI and follow this practice for 6 months and report to the Evidence-Based Practice Committee monthly. We'll also review unit MARS, medical administration records, monthly for indwelling Foley-specific placements or changes for rationale to ensure Foleys are not changed unnecessarily. Additional in-service will be needed if rationale not given or not fitting to the new policy. How we're going to anchorage this into ongoing practice is through positive recognition to staff who are embracing change by offering incentive such as bonus, pizza, gift cards, Employee of the Month nomination, continuing education. We're also going to ask for staff input for feedback and suggestions and clarify any questions or concerns to remove any barriers noted. Please see the works cited below.